All right. Hello, everybody. Sorry again for that delay. It's going to be a continual thing. I don't know why this little system, this software does that, but that's okay. So today we're in chapter 19, exercise behavior and adherence. Coming straight from your book as always. We're on page 435 towards the end. This was a cool chapter, especially for you that are desiring to be personal trainers, strength and conditioning coaches, physical therapists, occupational therapists, even doctors. So promoting healthy behaviors, physical activity. This chapter is extremely pertinent, and so if you haven't read it, please read it. However, a lot of the guidelines and the suggestions within this chapter, I think, are pertinent to everyone wanting to lead anybody or lead yourself. So I want this to be under 20 minutes today because in my mind, this chapter tends to repeat itself, not to the extent that it's the exact same, but it's enforcing a lot of the same ideas that it does at the first and towards the end. And so it kind of reiterates and rephrases. And so I'm just going to get to the main bullet points and tenets that I think it presents. And then, of course, in your own individual reading and in taking notes on your slides, you can go more into depth on that. So this will, again, be a supplementation to your reading and your notes coming from the PowerPoints. And so starting on page 435, they give you some interesting statistics in regards to physical activity and how of people 18 and older in the United States, 36 are classified as obese. They give you obesity rates of 30 to 37% of youth and adults, and 13 to 17% in youth. Approximately 1 in 5 adults meet the physical activity guidelines. Only 1 in 5. More than half of adults do not meet the minimum requirement of 150 minutes of moderate exercise per week. And so it gives you all of these statistics basically indicating that we as a nation need to exercise a lot more and be conscientious of our exercising and physical activity habits and eat healthier, right? So they give you a bunch of these awesome statistics. And then they go into reasons why exercise exists. And so I don't know how many of you know this about me, but my background before I specialized in sport and exercise psychology as a doctoral student was as a strength and conditioning coach and as a personal trainer. So I was a personal trainer for 6 or 7 years, mostly through my undergraduate days in my master's degree. And so this chapter really spoke to me because I was able to relate to a lot of it and pinpoint specific personal examples of the validity that they're talking about. And so starting on page 436, they go into reasons why people exercise. Number 1, they mention weight control. I think that's an obvious one. A lot of people exercise to look better, right? And sometimes that's a really good thing. They just want to look healthier and look better and have a physique that isn't expending all this energy, but being able to go on a walk or a hike or a bike ride and be okay. Like that's an awesome reason. Some of the other reasons are to actually present themselves in a sexy manner or a good manner, which again you can argue is good and bad, but that's one of the main reasons is because of weight control. Another good reason is reduced risk of cardiovascular disease. So reducing a lot of this internal buildup of disease, exercise, and especially cardiovascular exercise, so aerobic exercise, can combat that or help with that. And then getting into the psychological and emotional state, a lot of people exercise because it reduces stress and depression. A lot of studies, and as you read here in your book, have shown that simple movement, whether it's anaerobic or aerobic, can affect one's emotional state for the better. and our psychological state. There's physical reactions and hormones that are firing when you're exercising that aren't firing or happening when you're not exercising. And so there's physical reactions going on in our emotional and psychological state, and then just a subjective experience as well. Surveying people that exercise, they just feel better. And I mean, they can't pinpoint the physiological symptoms, but just that intuitive, subjective experience is overall better for them, which, as we know, is very important, just as the objective experience as well. People exercise because they enjoy it. I know I get up every day really looking forward to go to the gym. That's just me. And I know a lot of other people are that as well. It's a hobby. It's something that you want to do every single day. Another reason is because it enhances self-esteem along those presentational forms. Is when you look good, you feel good. You feel better about yourself. When you look in the mirror and you say, hey, not bad, your self-esteem goes up. Another reason is there's opportunities to socialize. I know this is a huge thing for many, many people, is going to exercise, especially with people or around people. Just that social facilitative environment can enhance the reasons why people exercise. The funny thing with me personally, I met my wife at a gym. Yep, I'm one of those guys. So I know what it's like to go to a gym and socialize. I wasn't one of those creepy dudes that is hitting on women at the gym all the time, I promise. I saw my wife, who wasn't my wife at the time, and thought, oh my gosh, I have to get to know her. And I did it in a very respectful, gentlemanlike manner. Had you. Anyways, so those are some of the reasons. I'm sure you can come up with other ones, but those are ones that they mentioned in the book. Now, reasons for not exercising or not getting involved in physical activity. Top 3: lack of time, lack of energy, and lack of motivation. Lack of time was huge for me as a personal trainer. They just couldn't fit it into their schedule. They didn't have time with going to work full time and taking care of a family and anything else, right? And then the free time that they did have was on a Saturday or a Sunday or both, like on the weekend. And the last thing they wanted to do was go be physically active or go to a gym and exercise. So those were the top 3 reasons, lack of time being number 1. And so they go over a bunch of these into depth in your book of why this is. And so this perceived lack of time, especially as being the number 1 reason, usually isn't because there's an actual physical lack of time. It's because of their priorities. Not all the time, but many times. So if you look at somebody who doesn't have a lot of time, again, they work full time and they're taking care of a family and community involvement or whatever. But then they also put on Netflix for a couple hours. They sleep until 8 or 9 a.m. They have the weekend watching college football for 10 hours. Like, where's your priority if you have time for Netflix and college football and sleeping in, but you don't have time to exercise? And so prioritizing one's time is generally the issue, not an actual lack of time. And then there's that lack of energy piece, which is really the number 2-sided reason of why people don't exercise. And for this, it's generally, at least what the research is showing, not because there's an actual physical lack of energy, but more a psychological lack of energy. They don't perceive that they are able to put in 3, 4, 5, 6 days a week of exercising, or even 2 days. So the perception and the interpretation of energy is lacking. The psychological framework rather than the physical framework. And then that third one, or at least one of the top 3, would be, again, lack of motivation. Actually self-motivating and implementing strategies and techniques to self-motivate and to put in a goal mapping like headspace so you're able to adhere to an exercise schedule. And we'll get into what that actual motivation piece looks like here in just a second, what you can do um, to combat that. Then they just go over sedentary behavior and explain what that is. It's essentially sitting. Sedentary behaviors, aka sitting, you're just not really moving. So non-sedentary behaviors, getting up and moving and walking around. Physical activities, actually exerting energy more than non-sedentary behavior. And then exercising is getting even more specific. So some of the problems of why exercise adherence exists, again, perceptions of one's lack of energy and of their emotional and physical state. They go over on page 441 that the prescriptions are often based solely on fitness data. So looking from a research perspective, they're noticing that the data on some sort of factor is the reason why people are ignoring physical activity, and they're not taking into account the subjective psychological experience. They're just looking at physical data. Most exercise prescriptions are overly restrictive and are not optimal for enhancing motivation for regular exercise. So once again, they're not taking in the motivational aspect. A lot of exercise prescriptions are very rigid, so they go off of age and gender and intensity and then prescribe the right exercise program, which can be effective, but it's not always effective because everyone is very different physically, emotionally, psychologically. And then some of these traditional exercise programs, they don't promote self-responsibility and self-motivational and self-monitoring aspects, which are vital to be able to adhere to a program. Starting on page 443, they go over some of your, I'm assuming some of your favorite models and theories ever. That was a joke. So they start with the health belief model. The health belief model essentially prescribes that a person's perception of the severity and or the potential illnesses or setbacks that can occur by not prescribing to an exercise program is dependent on that person's belief. And therefore either taking action or not taking action. So essentially, one's belief, perception, which is affecting their behavior or inactivity of behavior, in not behaving. Theory of planned behavior on page 444 is, as they state, is an extension of the theory of reasoned action. So that being that intentions are the best predictors for behaviors, and especially small behaviors. And so one's intention can predict the action, especially as a result or as it pertains to exercise adherence. So that's the extension of theory of reasoned action, but theory of planned behavior extends this theory of reasoned action in that it's not only the intention that predicts the behavior. I'm going to read it to you so it's a little bit easier to understand. Planned behavior theory extends the theory of reasoned action by arguing that intentions cannot be the sole prediction of the behaviors, especially in situations in which people might lack some control over the behavior. So, planned behavior theory states that perceived behavioral control, that is, people's perceptions of their ability to perform the behavior, will also affect behavioral outcomes. And so it gets into specifically the person's perceptions of what they have control over. And as a result, also what they do not have control over, and planning accordingly that will then affect their behavior. Hopefully that makes sense. And then it gets into some theories that we've already talked about, the social cognitive theory from Albert Bandura, and then the self-determination theory. So social cognitive theory proposes that there are personal, behavioral, and environmental factors that affect one's behavior. And so essentially, you have this individual who's different from person X, who's different from person Y, who's different from person Z, et cetera, et cetera, et cetera. Their behaviors are going to affect the environment. and vice versa, the environment is going to affect their behaviors as a person. And so seeing this almost cyclical nature relationship of the person, their behaviors, and the environment, which will ultimately affect, in this case, the adherence to an exercise program, being able to be physically active. Now getting into this motivational aspect again. So self-determination theory. I don't know if you remember, but from chapter 7, they talked about this in relation to motivation. And for me personally, it is one of the theoretical frameworks and approaches of how I propose motivation, work, inspiration for students, for clients, for anyone. Because it is my belief that motivation needs to be present for one to adhere, in this case, to an exercise program, and sustain that adherence. And so self-determination theory proposes that people, human beings in general, obviously it's contextual and it depends on a lot of things, but human beings in general need three things to promote this motivation initially and to sustain this motivation. And so number one is competence. They need to feel like they're actually able to do something. They need to actually know and feel like they can go walking on a treadmill. They need to know that they can actually get underneath a 45-pound barbell and do a squat. They need to have some level of competence. Number two is relatedness. So there needs to be some aspect of joining forces with other people around them, interpersonal relationships. And maybe that's this person's relationship with you as their personal trainer, as their strength coach, as their physical therapist, or maybe it's your client's relationship with the other members at the gym or the clinic or whatever it may be. There needs to be that relatedness aspect in order for this social facilitative nature to even take place. So that's number two. And then number three is autonomy. They need to be able to feel like they can do this on their own and be able to initiate self-motivation on a day-to-day basis. Sometimes when you're not even there, sometimes when you are there, but they need to have this sense of motivation that they can pull from every time they go to exercise. And so with self-determination theory, if competence, relatedness, and autonomy are not present, this theory posits that motivation and the sustainment of motivation will not be present. And this is something that I propose, and I'm a big adherent to. 445 in your textbooks. Then they go over a very important model that you are going to have to know on page 446. So let me show you what I'm talking about. This is called, it's hard to, the trans-theoretical model. And there are 6 different stages, and essentially it's a theory that proposes the different stages that an individual must go through to create change, especially to create lasting change. And so there's 6 different stages. And again, this is a theory that is for people. It doesn't mean that it's for everybody, and it doesn't mean that it's always going to work in the exact same step that it proposes. However, it's a great pattern of changes that one can turn to as a fundamental process to find where their client is at in this developmental change process. So number one, they describe it as the pre-contemplation stage. And again, I'm on page 446, going into page 447. And so with the pre-contemplation stage, essentially people are starting to think about exercising and physical activity, but that's it. It's a very, very, very little process in promoting that change. They're starting to contemplate what it might be like. Second stage is the actual contemplation stage. So now they're physically and explicitly and deliberately thinking about what that might look like if they were to place themselves in this stage of changes in physical activity and exercise adherence. That's the second stage. Third stage is the preparation phase. So now they're physically and mentally putting things into place to prepare them to start exercising. Sorry, the screen went dark. There we go. Number 4 is the action stage. So they're taking action and they're starting to exercise. 5 is the maintenance stage. And so now they've started exercising, and now they're on a month of sticking to an exercise program, and then 2 months, and then 3 months. And then the last stage is the termination and or relapse stage. So the termination stage meaning they've created this habitual habit of exercising, so they don't need to go through all of these stages once again. They terminate these stages, they are in it, they're good to go. Or it's a relapse stage where the maintenance stops, they stop exercising, atrophy occurs, and now they have to start over at the pre-contemplation stage. So there are your 6 stages: pre-contemplation, contemplation, preparation, action, maintenance, termination, and or relapse stage. But they coin it the termination stage. I also would argue that this would be the relapse stage where people have to go back. So 6 different stages of changes. This is called the trans-theoretical model by Prochaska and D. Clemente and Norcross. Excuse me. That's something that you should be aware of. They continue with other models and different changes. I know I said this would be 20 minutes, and so I'm going to try to hurry. Starting on page 449, they go over some determinants of exercise adherence. Essentially, there are personal factors and environmental factors, and they go over a bunch of these as it relates to demographics, so age and gender, psychological factors and headspace of being motivated, and positive body image or negative body image, behavioral consequences, social-cultural consequences, environmental, of course. And so with personal, so I mentioned personal and environmental. With personal specifically, there are both cognitive and personality variables within personal factors. So are they able to self-monitor? Is there some self-efficacy? Are they able to self-motivate? And then behaviors is another factor within personal factors. So the research has shown that the most reliable predictor of an exercise program or adhering to an exercise program is a past experience of being involved in an exercise program. That is the most reliable predictor. And then some environmental factors are the social environment. Again, we see the influence of the relatedness. The physical environment. Is it a gym where people really don't want to go to a gym, or do you exercise outside and you can exercise in a park? Physical activity characteristics within the environment. How's the intensity, the frequency, the duration? Are you comparing groups? Are you comparing individuals? What does that look like as the personal trainer, as the coach? And then the actual qualities of the leader within this environment. Does the client actually like being with you 4 days a week and exercising? Maybe not. It's a big influencer or determinant. They continue to go into different behavior modification approaches and reinforcement approaches throughout the book. And then they kind of wrap up, or start to wrap up, the importance, where this spoke to me the most, of cognitive behavioral approaches. So CBT, cognitive behavioral therapy, we know that thoughts influence emotions, emotions influence physical actions, and vice versa. Physical actions influence emotions, emotions influence the psychology of an individual. So keeping that in mind as a physical therapist, as a coach, as a personal trainer is super important how you design a program. How is this program that you've designed going to be an effective psychological, emotional, and behavioral consequence? Is it going to facilitate adherence? Is it going to facilitate enjoyment and ultimate weight loss and rehab and strength gain. So keeping this humanistic, holistic approach, I think, is very important when designing programs, especially if you want somebody to adhere to that program. And especially in regards to goal setting and goal mapping, in creating a program, and this is really with personal training, I think it is paramount that the client needs to know why this program exists. What's the meaning behind this program of meeting 3, 4, 5 days a week? They need to know that. And even more so, they need to be able to create that for themselves. And then they need to revisit it every day, every week, every month. So adherence is more likely to occur. At the very end of the chapter, they just give you some, once again, reiterated points of guidelines for improving exercise adherence. We went over these a lot. Matching intervention to the stage of change with the participant. And so finding where your participant is at in this 6-stage change process. Are they just pre-contemplating? Okay, well, adjust your exercise program. Are they in the contemplation stage? Are they in the preparation stage, the action stage, the maintenance stage? Do they need to terminate? Distinguishing and finding out which stage they are in can be very helpful so you're able to create the most successful program. Providing cues for exercisers like signs and posters, making the exercise enjoyable is always the best with music and different circuit training modalities, etc. Tailoring intensity and duration, especially as it relates to experience and age, gender. Promoting exercise with individuals, offering choices to these individuals, so giving them autonomy, there we see self-determination theory. Providing rewards for attendance and participation and meeting objectives. Individualizing the program, obviously, having participants reward themselves. And so if they adhere to the program for a month, they get a free night to go have any dessert that they want for one night or something. And then encouraging these goals with the important concept of flexibility and adaptability, because you never know what's going to happen and what might deter them from accomplishing their goals. That's essentially what this chapter is about. I hope you found it enjoyable, especially for those that are interested in health care, being a doctor, physical therapist, occupational therapist, strength coach, personal trainer, etc. I think this is an important thing to be aware of. Unfortunately, a lot of those individuals, those professionals that I just mentioned, don't take into account the emotional and psychological state of their clients. And as we know, hopefully at this point, the emotional, the psychological states are just as important as the physical states. And the physical state is just as important as the emotional and psychological states. They all need to be taken into account, especially if you're wanting to create adherence and ultimately create a successful program that will strive to be the very, very best that it can be. Again, I hope you found that enjoyable, interesting. If you have any questions, let me know. That's all I have for you. God bless.